Well, yes, as you see in the welcoming slide, Mr. Mike Egoh joins us now. He's the National Program Manager, Partnership for Transforming Health Systems. Thank you for coming on this morning.
Thank you. Good morning.
Well, looking at this health bill, you're aware of the different perspectives it's generating across board. Pharmacists also sent in the comment or two now, alongside those of the doctors, even lawyers also commenting on this. I mean, I see some people talking about Section 48 being subject to 53, which we'll go back and look at that, but it just dropped really late. You've seen all of those. What do you think of this bill?
Well, thank you very much. I think what I think of it is that this is the bill that will make Nigeria healthy. Let me put it that way. It's unfortunate that there are this infighting because the bill is focused on the client, not focused on the professions. It's focused on the client because it's the client that is sick. It's Nigerians that are sick that need help. So whether it's a pharmacist, whether you're a pharmacist or a doctor or a nurse or a lab scientist, the emphasis is on the client. At the end of the day, if the client does not get service, it's useless. You know, so I do not see why, because if you want to be a doctor, you be a doctor. And then you're trained to be a doctor from A to Z. You understand the system. A pharmacist is about drugs. Lab scientist is about doing analysis to make sure that there is direct diagnosis. So I really do not see why there should be any infighting, because if you look at the time it's taking this bill to be passed, 10 years, within that 10 years, over 9 million Nigerian children have died of preventable illness.
Why do you think that's what you call infighting?
The infighting is selfish, because there is infighting is because it's about position. It's about position. Who heads what establishment? Who heads what committee? That should not be the thing. A committee is set up to address issues. It's just like a minister is not, for instance, the person that implements. A minister is guided by a number of things. So the infighting comes as a result of selfishness, people wanting to hold position. But because they try to hold positions, people are dying. You know, that's why you have Nigerians running away from the country, because nobody is working, because the focus is about what they get as individuals or as professionals, not how the Nigerians are being treated or getting access to healthcare.
But couldn't this bill have taken care of that so that the infighting will cease? Because it's been distracting from the service that needs to be rendered.
A bill is a bill. A bill cannot take care of everything. I think what we should have done in 10 years is to have started implementing the bill and then amending it, finding out where the, crises are. In process of team formation, you have that, that rough stage, where you are like storming, numbing, and forming stage. We need to have got it. For 10 years to be storming, I think it's unacceptable. So I think the bill cannot take care of it, because the tertiary health committee institution that was recommended is what created the problem. Who heads that committee? Somebody somewhere will have to head that committee. That should not have held this country hostage for 10 years. And the people, like I said, people are dying. Women are dying every day. As we're speaking here, people are still dying. Because some individuals want certain position in an establishment or in a committee.
Well, I'll go into specifics now. What good would you say you see in this bill?
The good is, number one, specifically, today the Nigerian medical tourism, you know how high it is. If you cost it out, you know how much money this country is losing. Going to specific, it will give access to the common person at the grassroots level to quality healthcare services, because everybody is protected. Their right, the right of the service provider is there on the bill. The right of the patient is there in the bill, so you cannot just do a thing and make the client look like he has no option. There's an emergency situation where you must treat that person. You cannot turn the person away. A number of people are dying, even from accident. They are taken to hospitals. They are turned away because they have no money. But this bill takes care of that. So the bill, for instance, will reduce the poor health indices, where Nigeria is like one of the worst in the world today. So that going to specific is access. It's about access. It's about equity in distribution of resources. It's about improving human resources for health, making sure the right people are there. It's about looking at standard, you know, ensuring, because people just practice. There are some people who have left school in the last 20 years and they've never gone for training. You know, so this bill takes care of some of this.
You know, I'm thinking of something about this bill. If we say organs are not for sale, why is it that, well, especially even in government hospitals, we still, well, sell blood? Even though the man or woman has come to give you freely, when it's being administered to the patient, they collect monies. How can this bill help put a stop to such?
The bill will put a stop to such because, in such a way that, because right now people go to sell as a result of poverty. And because if people are not selling right now, you will not even be able to save lives. That's why people are going there. And the hospitals don't even have them. We have blood banks that are established, and we've been trying to educate people to come, because there are a number of us who carry much more blood that we even require. We can still donate. You know, so this bill will enable people to be educated, to be informed, that they can provide the blood freely. You know, because there is that culture is not here right now, where you just walk into a hospital to donate. I donate every year. But that culture is not there. This bill will enable people to be educated, to be informed, and to make right decisions, to make sure that another person's life is safe because they've taken a responsible decision.
What do you think about the complaint or the concern of pro-lifers who are thinking there's a cartel of organ sales in the world, who are now looking for how to cash in this country? Because, I mean, I see some comments coming through saying, well, India has tightened the noose, so people are beginning to look elsewhere, trying to cash in here.
Well, that's true. Like has been said, whether we put that control or not is happening. People are leaving this country to go outside to sell organs. I know the price in, I don't want to, where you mention India, let me just mention India. $50,000. People go there, you know, and Nigerians are going there to donate organs. They go there and from there cross over to Dubai to buy wares to come and sell in Nigeria. Because instead of dying, they believe if they can donate one kidney, they will still survive. So they're becoming businessmen by selling organs. It's not being controlled.
Isn't it two different things? I mean, if you go out and go do somewhere, but if you're within this country, within the confines of this country, the laws, that's why they're saying, no, you shouldn't give this window, because they think that there's a window that they can latch into here and take organs for, perhaps in the name of one thing or the other, and begin that cartel of selling organs from here.
Well, again, that is true. I think the thing is to tighten our internal system to make sure that the cartel, I don't know about the cartel, but I know it's happening globally. It has been happening for a very long time. Some people have been doing it unchecked, which is why I am happy that it's on the bill to control it. But the thing is to tighten the internal system to make sure people don't sell their organs, that this place does not become, because Nigeria is a marketplace where their laws are made and they are not implemented or, you know, followed through. So for us not to even talk about it or not to tighten the nose would be like opening the market to this cartel. So I still think a lot of education needs to take place. A lot of control, you know, some kind of standard need to be there to make sure that hospitals are aware of these provisions and they're not buying or selling organs, or they don't become a conduit for organ sale outside the country.
Okay. You said something about specificity, being specific here. The bill wasn't very specific about the kind of infrastructure that should be provided. Is that good enough? And you say this bill will ensure that people are saved.
I think it talks about the infrastructure that should be provided. There are 3 tiers of government, system in Nigeria. You have the primary care, you have the secondary care, you have the tertiary health care. Their standards have been set, you know, because again, this is...
Who set the standards?
Well, this bill is making provisions for those standards to be set.
So the standards have not been set?
They've been there, like the primary health care agency have a standard of what a head post should be, the number of personnel that should be there, and the quality of personnel that should be there. Primary healthcare center, what the number should be, how many doctors, or, I mean, there's no doctor, that you have community health extension workers or community supervisors or community health workers. You go to a comprehensive health center where you have a doctor. So those standards are there, but the problem here is that we are not able to meet those standards because there is no fund. We do not have the human resources there. The human resources that are being trained here, they leave the country to go and serve elsewhere.